Hey, my name is Emily Corley, and this is my video on spinal stenosis. So what is spinal stenosis? This is the narrowing of the spinal canal that houses the spinal cord and or the narrowing of the intervertebral foramina that house the nerves. And these are just bony openings on the spine. The narrowings will eventually compress the spinal cord or the nerves, and this can typically occur in the cervical or the lumbar spine. Symptoms include a dull ache, a sharp shooting pain, numbness, tingling, and weakness, and poor coordination. And in severe cases, it can cause loss of bladder or bowel, depending on the spinal cord involvement. The actual narrowing of spinal stenosis, the bony narrowing, is not what causes the pain. What causes the pain is the compression on the cord or the nerves. And this picture shows radicular pain in the lower extremity. So the pathology and disease process, spinal stenosis is most commonly caused by osteoarthritis, degenerative disc disease, and ligament thickening. OA occurs when the smooth cartilage starts to wear away and the bones will rub up against one another, and that creates osteophytes or bone spurs, and with more bone becomes more narrowing. And so degenerative disc disease occurs when the intervertebral disc will flatten, they'll lose hydration. Then again, the bones will begin to rub up against one another and create more bone. The foramina will begin to narrow. And in ligament thickening, the ligaments actually begin to ossify, which means they kind of begin to turn into bone. So with more bone will cause more narrowing. This is represented in these pictures right here. You have central stenosis, which is the spinal canal is narrowing, and lateral stenosis, and that's where the foramina is starting to narrow. So who's affected? Men and women are both affected, and really anyone with any age is affected, but it's more typically seen in older population over the age of 50. It's found that 1 in every 1,000 persons older than 65 and 5 in every 5,000 persons older than 50 experience symptoms of spinal stenosis. Now, a lot more people could have it, but might not be experiencing symptoms. The nerves of the spinal cord might not be compressed. Younger individuals can also have it. Might not be weight or age related. It could be related to a birth defect or other things along those lines. Overall, the prognosis for spinal stenosis is very good. Individuals can get symptoms relief from conservative measures such as PT. If that doesn't work, they might have to make a more invasive approach such as an injection or undergo surgery. The prognosis tends to go down depending on how long the nerve has been compressed or the spinal cord, and they might have permanent nerve damage. So physical therapy interventions includes stretching, strengthening, manual therapy, postural education, modalities. These are all very important. The manual therapy can be done to the paraspinals on the back because your muscles will get tight from being in pain, and that could help the patient relieve some tension. Postural education is going to be really big. We don't want a forward head or slumped shoulders. We want them to sit up straight, so educating them on that is important. Modalities just to help them feel better, ice, heat, lumbar traction to kind of get some traction, some space in those vertebrae will be very important as well. So here's some exercises. We have our pelvic tilt, bridges, clamshells, single knee to chest stretch, lower trunk rotation, good gentle movement, hamstring stretch, and abdominal crunch. The ab crunch is very important as we want to keep our core tight to really help give stability to our overall trunk. And these are examples of the lumbar and cervical traction. A patient can also do positional traction. It might not be as effective just because it's a little bit more gentle, but it is an option. So medical interventions includes, this is kind of the next step. The MD will determine if the patient needs an x-ray to look at the bony growths or an MRI to see discs or other soft tissue damage. And from there, they will establish a plan of care. So it could just be taking NSAIDs such as ibuprofen for the anti-inflammatory effect. It could be getting a corticosteroid injection. It's injected where the nerve is pinched. So that'll help reduce the pain and inflammation also. If that doesn't work, then surgery is most likely indicated. and that's just when all other forms have failed. So those type of surgeries, you have a percutaneous image-guided lumbar decompression. This sounds a lot more intense than it really is. This is actually the quickest one people recover from. It's an outpatient surgery that releases the ligamentum flavum, which increases space in the spinal canal. Then you have a laminectomy. It's the removal of the lamina, which makes room for the spinal cord and nerves. It can also be a partial removal. And then you have a foraminotomy. It removes bone spurs in the foramina, where the nerve roots live, or a spinal fusion. This is definitely the most intense. They fuse the spines together, the vertebrae together with plates and screws. And this could take up to a year for the patient to fully heal from. So I chose this topic just because I'm currently working with a lot of patients that experience pathologies that cause spinal stenosis. And I felt like it would be beneficial for me to learn more how to better treat these patients and kind of learn more of their symptoms and how to help with that, just because I am seeing so many of those kind of patients right now. And being able to treat these patients effectively is very important, and keeping them out of surgery is ideal. So that's why I chose this topic. I found everything very interesting, and if you have any questions, please feel free to ask. And these are my sources. Thank you so much.